Assalamu alaikum and good day. Hello everyone. So this is topic for this week, seeking and using healthcare services. What is this topic is about? Actually, we are looking on a person or individual behavior when and how does a person decide when he or she is sick or ill, and when a symptom dismiss, why they become adhere or non-adherence, and why they decided to be to delayed in their treatment, seeking treatment, and what are the factors that causing a person to use healthcare services. Okay, so before we proceed, a reminder, this slide is under protected of Intellectual Property Act, specifically to be used for students under health psychology course. So these are the three subtopics that I mentioned earlier. First one, how individual recognize and interpret their symptoms and which lead them for seeking appropriate treatment. Second, who and what actually factors that influence a person to use a healthcare services. And third, the issues of misusing the healthcare services. The issues of misusing can be divided into first, inappropriate use, for example, like uh, using the medical cheat, or rather using the medical excuses than seeking for appropriate psychological treatment. And third, a delay behavior in seeking appropriate treatment and causing the illness become severe. Okay, so now we look on the recognition of symptom. Recognition of symptom is based on the individual differences. So, as we know, as you learned in earlier semester under abnormal psychology, there are different types of personality. Okay, so those who is a hypochondriac person, okay, they tend to believe the normal bodily symptom as an indicator of illness, and these are the person that will use extensively of the medical services. Okay, so for example, most frequent symptom experienced by people who convert their distress into physical symptoms such as back pain, joint pain, pain in the extremities, headache, abdominal symptoms such as bloating, allergies to particular foods, and cardiovascular symptoms such as palpitation. Okay, so as opposite to the stereotypes, women are not more likely than men to report the symptom. Okay, but there are pronounced age effects with older people reporting more symptom than young people. Okay, so um, as compared to those neurotic person, as we know, neurotic are who are neurotic person, they are those who are having depression, anxiety, okay, and other emotional symptoms. Okay, so people who are high in neuroticism, they recognize their symptom quickly, and they also tend to report their symptom quickly as compared to those who are non-neurotic. Okay, and they also often have erroneously believes that they have serious diseases. Okay, so a narcissism person is a pervasive negative way of viewing their world by negatively emotion. So they look everything from their perception negatively, and they become more self-conscious and concerned about their bodily process. So most of the neurotic person, especially those who are anxious, who are anxiety, they may exaggerate their symptom, and they may also simply be more attentive to the real symptoms. Okay, but remember, this personality, they are not consciously doing all the symptom or reporting the symptom, but this is part of their diagnosis of hypochondriac and also neurotic. Okay, next will be attentional differences. The first, we look on the individual differences. Second, we look on attentional differences. So, how attentional differences affect on the recognition of symptom? People who are focused on themselves, for example, their bodies, their emotions, and also reaction in general, they are those who quicker to notice symptoms than people who are focused externally on their environment and activities. So people who hold boring job, for example, like a housewife, okay, or those who live alone, they may report more physical symptoms than do people who is having interesting job and who are actually having active and busy social life. Okay, so people who experience more distraction and attend less to themselves experience fewer symptoms than people who have little activity in their lives. Okay, so next is situational factors. What the difference between situational factors and attentional differences? Okay, so situational factors is based on the situation, a boring situation that makes people more attentive. Okay, for example, like watching movies, a boring movies. Research suggests that people are more likely to notice itching or tickling or coughing a response during part of movies that boring as compared to interesting part. Okay, and a symptom is also likely to be perceived um, on a day when a person at home as compared to during the partying or socializing. Okay, and another example of situational factors such as a common phenomenon in medical students, okay, is called as medical student disease. Research suggests that uh, by studying a symptom, okay, any illness or symptom actually leads students to focus on their own fatigue and also in other internal states. And the consequence of studying these illnesses, actually they also have the own fatigue experience actually, and a symptom of the fatigueness is consistent with the illness that being studied. Okay, so I think it's also almost similar with psychology students also. Like I have experienced some of students came to me, mentioned that they have a certain kind of psychology abnormal symptoms and criteria, especially after they learn course under abnormal psychology, and sometimes they try to make the similarity between them and also definition of the illness. Okay, so this is actually the situational factors, how by studying a certain cause or criteria or symptom that lead them to have a similar a focus, okay, a focus that they make them feel that they also experience the same illness. Okay, next is a stress factor. Stress factor is related with the physiological changes that occur due to the prolonged duration of stress or threatening stress experience. Okay, so these physiological changes, for example, like fast heartbeat, okay, sweating. So these are example of the physiological changes, and based on these changes, lead people to believe that they are ill. And next is a mood and symptom. Mood and symptom actually affect the person perception about their symptoms, illness, and also how they perceive their vulnerability to illness. Based on research suggests that people who are in good mood who have positive expectation, they actually rate themselves more healthy, report fewer illness related memories, and also report fewer symptoms as compared to people who in bad mood. Okay, those who in bad mood, they have more negative expectation, they report more illness symptom, and more pessimistic that any action they might take will relieve their symptom and perceive themselves more vulnerable to future illness. So these are all the research science-based evidence that they conducted and compare how does all this emotion related with the how people recognize and also interpret their illness symptom. Okay, next we look further on what factors that influence interpretations of illness symptom. Okay, so um, the basic concept of interpretation of symptom is based on the psychological process. Okay, basically it's based on the psychological process, how people interpret, how people perceive their experience, okay, based on their based on the symptoms, based on the experience, based on their expectation, and also based on the seriousness of the symptom. Okay, so if prior experience, for example, okay, um, this is where a, a common disorder, okay, for example like flu, okay, is regarded less serious as compared to rare disorders. Okay, so we have experienced flu. We know that when you have flu, you will recover after 1 or 2 weeks. Okay, and sometime within 3 days with help of paracetamol. Okay, so this is referring also to COVID-19 issues where some of the symptoms are same as as flu, having a coughing, a sore throat, a high fever. So this is where at the initial stage of COVID-19 pandemic, most people just ignore because they thought this is just some another flu that come from Asia. Okay, so this is that actually it cause people take it less seriously as compared to rare disorders that they never know. Okay, so um, research suggests that, okay, people who have experienced a medical condition will estimate the prevalence of their symptoms to be greater and often regard the condition less serious than do people with no history of the condition. Okay, so meaning people who always have a frequent history of illness, they usually will interpret their symptom less seriously and will might delay in seeking for appropriate treatment. Okay, next, expectation. Okay, expectation is based on unexpected symptom are being ignored and expected symptom are being amplified or exaggerated. Okay, so this is where when people feel vulnerable to disease, okay, they are more likely to interpret their bodily sensation is as indicative of illness and even regard other people in environment as potential disease carriers. Okay, so give an example in the textbook. A researcher conducted study a number of women, okay, uh, and looking on their date or the symptom, the psychological symptom of menstrual. Okay, so what happened? The researcher divided the participant into two groups. The control groups where for basically the participant was not told or was not led to believe that nothing will be changed. Okay, not the premenstrual will not be happen. Okay, but another group, they are led to believe that their period will be due within next day or two. Okay, so as compared to control and the intervention group, showing that the group of women who have been led to believe that the period or their menstrual will be the next day or two reported more psychological and physiological symptoms of premenstrual than did women who were told that their period will not due for 7 or 10 days. Okay, so these are the comparison between two groups. How actually your expectation will influence on your psychological belief. You have the illness, you will experience the physiological changes in your body and etc. Okay, next, the seriousness of the symptom. uh, so this is also based on the physical character of the illness and symptom. Okay, research suggests that symptoms that affect highly valued part, for example, like face and a lot upper limb, okay, the upper limb is interpreted as more serious and likely to be required attention rather than that affect less value organ. Okay, so people are especially and more anxious when their eyes or face are affected, but less if a symptom involve the part of trunk or a lower limb. Okay, so next on the example, okay, I would like to give an example based on one of my patients that I interviewed for my research study. Okay, MMS, 50 years old Malay male. So he's a patient with coronary heart disease. Okay, so let's look on his quotation. Okay, basically this is a qualitative study. Okay, so he said that the pain is called angina pectoris. It is really painful, and if the artery gets even more narrow, one is completely blocked, that's the end of you. That's all, and why it is advised to be aware of it before it's completely blocked. Okay, and that's why there are cases where people pass away suddenly or when they are asleep, like my younger sibling. He was at a meeting with his friend, suddenly he collapsed. I think my case is similar like him, and that time my younger sibling wasn't aware about at all about his blockage. Okay, so this is the keyword where actually this patient telling about his little brother meeting with his friend suddenly collapsed. Okay, and next. Okay, next he mentioned that, so I do thank God that he gave me a sign of my illness. Okay, he gave me a sign of my illness, but if you don't take action, you will get it anyway. Right now my other younger siblings take care of his health well, and all of my younger siblings do. My other younger sibling takes his medicine, takes care of the genetic factor, and is worrying really is the risk factor. Okay, so meaning from here, this patient actually sharing about his experience based on his own little brother, where his little brother is passed away because of sudden heart attack. Okay, but actually in the overall interview, actually he mentioned his little brother have experienced some early symptom before the final heart attack. Okay, but he not aware, and he just ignore all of his symptoms. So this is referring to the seriousness of symptom. Okay, the factor of seriousness of symptoms. Sometimes people might take it less seriously when they feel like, oh, this is maybe just a minor chest pain. Okay, because they can't see the wound. You can't see how severe is the chest pain. So this is where they tend to ignore the illness. Okay, but learning from his younger brother experience of being passed away, so this patient and also his other younger siblings take care of their health and make sure that they take the medicine and also take care of the lifestyle changes to avoid of having the same experience. Okay, so this is interesting example of a patient with heart disease, where we learn how they perceive the illness, how actually they make changes and interpretation of the symptom based on their prior experience. Okay, so now we look on the cognitive representation of illness. Cognitive representation of illness. So cognitive representation is based on how people hold beliefs. Okay, and how actually their representation, the perception upon the cognitive about the illness, and how does affect the treatment seeking behavior. So this cognitive representation of illness is explained through common sense model of illness. Okay, common sense model of illness is another theory. Okay, is another theory, same like the health psychology theory, but in health psychology theory earlier that we learned, it focused more on health behavior change toward exercise, diet, and other lifestyle changes. Okay, but in common sense model of illness is specifically to represent on how people thoughts, thinking. Okay, yeah, their cognitive thoughts on what the factors that influence on them and taking precaution measures ataupun what make them want to believe on the causative factors of the illness, which lead them to make appropriate action and treatment. Okay, so based on the common sense model, illness is divided into a few factors. Okay, divided into a few factors. All right, see what the common sense model explain how a person respond to and manage to their health threats. Okay, so it is part of the understanding on the factors on how people actively engage in the problem solving towards their health threats, and also what lead them in their making decision towards the appropriate treatment. Okay, so the common sense model divided into two parts. The first one is illness representation. Okay, under illness representation or illness perception, there are identity, causes, consequences, timeline, and control. Identity is basically the name or label of the illness. Research suggests that if a person knows the illness name, the identity of the illness, they will take appropriate measures for the preventive as compared to illness without specific identity. For example, like COVID-19, if you still remember last year, this is where the COVID-19 was not defined yet appropriately. What are the symptoms? What are the specific definition of the symptom as compared to the normal flu? Okay, I still remember one of article that I read. Okay, based in, I think in BBC or CNN, in early 2020 when the pandemic just started. Um, I think during that time Donald Trump is still the president. So it's a very interesting article when they mention that COVID-19 is actually a flu that come from Asia. So it's just a flu. Okay. So this is where the dangerous of the illness, that when we not knowing the specific definition or level of identity of the illness, it can cause delayed behavior of taking the appropriate treatment or action. Okay, next, the causes. Causes is related with factors that factors or belief that have led to the illness. Okay, for example, why is important for us to know the causes of our illness? Okay, for example, my own experience interviewing a patient with heart disease. Okay, some of them believe that their illness of heart disease is not due to any medical explanation. Some of them mention that it may be due to the shamanic behavior, or maybe due to the black magic. Okay, so because of that belief, they refuse to make healthy lifestyle changes. Okay, even during my interview visit, um, without uh, without any guilty feeling, actually he brightly mentioned that this morning I took roti canai and also nasi lemak brought by my children. Okay, actually he was warded. Okay, he was actually warded in the IJN. Okay, so it is explain why is it very important for our patients to know what the main cause of their illness. When they understand and they believe the cause of their illness, they will make a further movement towards appropriate intervention. Okay. Next, consequences. What is consequences? It is the symptom, related to symptom of the illness. Okay, related to the symptom of the illness. How severe is the illness? If the illness is severe, for example, cancer. Okay, those who are being diagnosed with cancer. Okay, sometimes cancer, different stage of cancer, stage 1 and compared to stage 4. Okay, during the stage 1 of cancer, usually the patients without the symptom, okay, without the physical symptoms of the consequences of the first stage of cancer, they will delay in seeking treatment. What will they do? They will go shop to different hospital and clinic. Okay, because this is part of their denial of rejecting the diagnosis by doctors. Okay, but when they reach in the stage 4 of the cancer, when they start to experience the symptom, the consequences of the illness. This is where the impact affecting their quality of life, okay, giving more burden to their life, and also financial extreme. Okay, so this is where they started to believe, and also they started to take the all the suggestion given by doctors and taking the treatment and also medication as given by doctors. Okay, so the consequences of the illness is also important, where it also can influence on how patients make their decision on the treatment. Next, the timeline. Okay, timeline is referring to the length of time of the illness, the duration of the illness. So if the patient is informed about you are diagnosed having diabetes. Okay, the timeline of diabetes. So diabetes, for example, is a chronic illness. Diabetes is a chronic illness. It is a long lifetime lasting. Okay, but the symptom is not as the chronic pain, because those who suffering diabetes, they not having any pain. However, if they're not taking medication, they did not make their lifestyle changes, they will suffer stage by stage physical changes due to the diabetes impact. Okay, so how the timeline of the illness as compare, okay, for example, like a patient diagnosed as diabetes or patient diagnosed having flu. Okay, so the way how they respond in seeking or interpreting the illness and seeking for treatment will also be different. Next, control and cure. This factor is referring to whether the person believes that the illness can be managed or cured. Whether the illness can be managed or cured. So this is also another important factors. That referring to it's include how the individual believe of how much he or she has ability to manage or control the illness and its symptom, as well as representation of how control should be achieved. Okay, so this also referring the same to the illness such as cancer, diabetes, and also hypertension. Okay, so how much the patient or the person believe that they able to manage, they have this the self-care, they able to look after their illness, they able to look after their own medication, is very important on how they decide on the next stage of the pain management or illness management. All right, so for example, like they believe that I'm in cancer stage 4. Okay, I don't have any more control of the illness. Okay, so this is where if they demotivated, okay, they demotivated, they not believe on their own control of the illness. This will lead them to become non-adherence, and also this will make them become one of the non-compliance patients toward the prescribed medication. Okay, so it's very important for a doctor uh, to educate. For me, my opinion as a health psychologist, is very important for us to educate the patients, okay, about their illness, the causes, the consequences, the prognosis, basically the prognosis. What are the prognosis at certain time? How long they will they will have to take the medication, for example, and how actually they can control themselves independently without the medication, for example. Okay, so this is where we give the patients their own independent and also their own control for them to be cured with their own illness. All right, next is referring to the emotional representation. Okay, just now the first component we look on the illness representation. How the illness been perceived by the patients. Second part, we look on the emotional representation, how people feel about the illness, and is it possible, is there any possible cause and treatment. Okay, so under the emotional representation, where also factors of coherence. Okay, there's factor of coherence. So coherence is referring to how well of this belief in a cognitive representation hang together in a conjoint representation of disorder. So so this representation is based on the three models of illness, which is the acute illness, chronic illness, and cyclic illness. Okay, so the way how people have the conception about the illness is varying. If they perceive my illness is acute illness, perhaps they know the acute illness is a short term, is maybe is on due to the bacterial agent. Okay, and for example, like flu is example of acute illness. But the way how they represent the illness as a chronic illness, they know it is multiple factors. It can affect the health habit, the duration, and other severe consequences. Okay, so based on this conception of illness, how a person understand and they conceptualize of their own illness is very, and it's also greatly influenced on their behavior related to the disease, what next to do, what they should do, and how fast is their reaction towards the illness. I met several patients with heart disease, for example, because they say they have multiple chest pain. Okay, but because of they don't understand about the illness, they thought it's only chest pain. It's only like maybe just acute, and some of them mention about angin. It's a wind factors, so they just ignore the illness, and finally they have the chronic heart attack. Okay, so interesting about the illness perception questionnaire. The illness perception under the common sense model. Okay, other common sense model, beside than the model itself, it also provide you a questionnaire. Okay, so for example, if you are interested to conduct research on the patients, you want to look on what is their illness perception, that actually can lead you towards what is suitable type of intervention that you can provide according to the factors as you mentioned earlier, the identity, the causes, consequences, timeline, and control. So based on these, we actually can make a survey based on a questionnaire, and from there we can get idea what actually this patient is having issue. Okay, on which factor that they have issues at. So this is example of the brief illness perception questionnaire. This is the short form that you can use for future research study if you're interested to look more on patient illness perception. Okay, and this is example of research article. Kate J. Petrie, Elizabeth is one of the famous authors or researchers in health, in the common sense model of illness. Okay, so they are actually health psychologists, so they look towards more on illness perception and how as the therapists we should provide patients on intervention that relevant with their own perception or their own needs. Okay, this is what we call as a patient-centered service, meaning the services that we provide to the patient is not based on what we want, not based on what the therapist want, but is based on what the patients want. Okay, the fifth factor that influence the interpretation of symptom is called as Lee referral network. Okay, so it is actually an informal network of family and friends who offer their own interpretation of symptom, and it's always influence how patient make decision on their treatment. Okay, so this kind of interpretation of symptom was given voluntarily by friends or family before the patient seek out for the medical treatment. Okay, so usually patient will mention a symptom of will mention a symptom to their family members or to their friends, and then I'm having this kind of symptom, this flu, at the same time itchiness. What do you think? And it can be, and their friend or relative may offer advice that oh, this is nothing. This is just your just some mild allergy because the food. Okay, so this actually influence how they will sought for the treatment. Okay, um, it can be a positive, it also can be negative types of advice. If the friends or relative is educated, okay, based on a study, they suggest that education and socioeconomic status also influence on how the lay referral networks will advise or give opinion to the patients. Okay, so if they are higher educated, they are aware about the illness, so he might offer positive advice, better to go for the to seek for medical treatment. Okay, but contrary, some of the friends or their family might advise, oh, don't have to go to the doctors, it's very expensive, just use some home remedies, lemon and vinegar. Okay, and you just blend out all the lemon and vinegar with the garlic, so it will helpful to improve on your illness. So these are example of natural remedies that frequently or common being suggested by the family members and friends. Okay, so in many communities, especially the minority communities, the lay referral network is the most preferred of the treatment. Okay, so a powerful lay figure, okay, for example, like an older woman, okay, as that has many children, or male act as a lay practitioner. This is it is one of the culture that happen in Mexican. Okay, so because of her experience, perhaps like she has this kind of shamanic features, and the community assume her to have personal wisdom in medical matters, and also she become the most referral network from the community. Okay, so if this within this ethnic community they have this kind of beliefs. Okay, they have very strong belief that about the shamanic, about the black magic, about the traditional medicine. So this kind of treatment will be the first most priority treatment as compared to the modern medicine treatment. Okay, so they will have this kind of thinking that we should seek out for the traditional medicine or home remedies that is more effective than as compared to the modern medicine. And actually surprisingly, this is not happen this is not this is actually still happening now. For example, in my own research I conducted among the heart disease patients, like most like 80% of them, when I ask what is the first mode of treatment they will seek out when they have the symptom of chest pain, or when the doctor mentioned that they have to go to surgery for the heart treatment. So the first reaction they will say that of course I will go to the traditional medicine first. I will try all the natural remedy first, because we're scared of surgery. We don't want to go through the surgery. So we try all these natural remedies. We mix up all the vinegar and the juice, lemon, and etc. Because they say it can improve our cholesterol level, for example. Okay, but at the same time, when I ask about do you control your food, do you practice exercise, nil. So they are actually not change their lifestyle, but they rather to take this kind of natural remedies as a fast or magic pills, orang kata, to improve, to get fast improvement on their illness. Okay. Next, the internet. So internet itself is one of the factors that influence in the interpretation of symptom, not only among the common people, but it's also one of the most health information sources that been used by the doctors. Okay, so even doctors also, research suggests that even doctors also um, also reported that they also depends on the internet, okay, with the most up of dated information on the illness and treatment. Okay, and 96% of them believe internet will help affect their healthcare more positively. Okay, but there are one downside of the internet. This is also lead to false testimony. Okay, false testimony for the patients. Sometimes patient they will look for further information beside than doctors. So what happened, for example, in Malaysian public hospital, we have a lot of patients, but like one doctor will have to look after like 50 to 100 average of patients. Okay, so per day. So uh, can you imagine, do they have time to educate the patients in detail about the illness and also the consequences of the illness, or maybe the self-care after discharge from hospital? So this is where patients will look forward for seek will seek for the information from the internet. Okay, but in the internet there can be positive, there also can be a contradicting information, especially those who are claim on traditional medicine, natural remedies, or maybe some juices that related with traditional medicine that is effective for the illness treatment. So this is the downside of it, where some of the information is in the internet is not based on a research-based evidence, and it give inaccurate information for the patients, and finally patients tend to have misinformation or misconception about the illness, the appropriate treatment, and sometimes they might blame the doctors or modern medicine because their illness is not cured because of the modern medicine. But actually what they did, when they taking the traditional medicine as claimed in the internet good, at the same time they not compliant to the modern medicine that been prescribed doctor. Okay, so it can be positive and also can be a negative influence for the patient. So this is where it's very important for the health practitioners to give a comprehensive information, okay, or to provide support for patient before they discharge from the hospital, because we will want to make sure the patients to adhere to our medication, to adhere to our treatment before they have a different belief or misconception about the treatment given. So next we go to the second subtopic, who uses the healthcare services more. So as compared to the first subtopic, in this subtopic we look on the criteria of the patients or persons, what makes them to use and also to sought for the healthcare services more as compared to other person. Okay, so the first factor is age. As we know, the infants, young people, okay, and elderly, they require more health services more frequently because of their, like young children, they develop numbers of infection, childhood diseases, and require vaccination to develop their immunities. Whereas in the late adulthood, where people begin to develop chronic illness and diseases of aging, this also cause them to seek out for health services more as compared to the teenagers or young or also mid adulthood. Okay, Next factor is gender. Research suggests that women use medical services more than men. So why is this happening? First, as we know, women pregnant and also childbirth. So because of this process, cause them have to visit a hospital or clinic for antenatal checkup frequently. Okay. Another explanation is because women have better homeostatic mechanism as compared to men. Okay, because they actually they report pain earlier, they experience temperature changes more rapidly, and they detect new smells better faster than men, and also they are more sensitive to their body disruption and especially minor changes, okay, as compared to men. Another explanation, as we know, men are expected to project tough macho image in the culture, okay, whereas women are not subject to the same pressure. So I still remember sometime during my childhood, my mom always say, alah alah, anak lelaki, alah alah, you only a boy must be strong, shouldn't cry, okay. So that is actually common culture in Malay. I'm not sure about Indian and Chinese, but Malay, my mom always say like that to my brother, don't cry, only small matters lah, okay. You're a boy shouldn't cry, okay. A boy should show you are strong, okay. So there is common expectation that be inculcated on the child since the childhood until the adulthood. So they will show more tough image that they shouldn't show their pain as compared to women, okay. And women also use healthcare services because of they have several issues. So for example, like for their gynecology, for pap smears, for breast cancer, okay, like they have menstrual. Sometimes some women really suffer due to the menstrual. So all of these part of their physiological body require them to visit medical care more than men do. All right. And next, the psychological factors. The social psychological factors. Okay, the social psychological factors is referring to the individual attitude toward life, and his or her belief about symptom and health services. Okay, so social and psychological factors is actually related strongly with the socio-economic factor. Okay, the socio-economic factor. First, it can be based because of the financial support. Okay, so if you have better financial support, you have more money, and you have better access to healthcare services. Okay, so another part is because of the socialization by the parents. So as I think we discussed in earlier topic, okay, where if parents we don't during the window period of vulnerability, where if parents teach their children, once you have flu, once you are ill, so I'll bring you to clinic, okay, I'll get you medication soon as possible. So the children and adolescents will learn the health behavior from parents, and they also learn when and how to use the healthcare services, okay. So if the parents said, it's okay, this just a minor pain, just take paracetamol, that's all. So they also will repeat the same behavior as what been taught by the parents, okay. So this is the factors and the social and also psychological factors. All right, so it's a look on how the parenting, how the social economy, and also what are the culture that been that the community go through, okay. And it's actually involved about the need, if the people need, okay, need on the for them to get cure, okay. The time, for example, about time, yes, maybe I have illness, but if I'm too busy with my work, okay, I may delay to getting the treatment, okay, because of I don't have time to go to the clinic. Meaning going to the clinic may take as part half day of my salary, for example. I have a client or patients before that, when they send their child for to me for the psychological assessment, okay. So when I asked, they said like, can you complete all the assessment by today, because like I can't come again, because one day meaning one day absent, meaning I will lost one day salary for that day, okay. So we these are actually one of the most important issues also that related with healthcare services, seeking out of for the healthcare services because of money and also commitment towards their own job, okay. So they have prior experience by the parenting, they also believe on the favor of using the service. So if for example like, they have a previous experience that very bad experience of using the healthcare services, so this actually will delay for them to seek out for another treatment. They feel like, oh, during my first visit, doctor just said I'm fooling around, okay. So another so they will avoid to go another visit because they'll see doctor will just say the same thing, and doctor just prescribe me the paracetamol, that's all. So these are example of the belief, okay, belief that favor the use of service, or maybe make them have a negative experience of using the service and also access to the service. All right. So uh, the final one is the social class and culture. Social class and culture is also relevant with the financial status, okay. So like poorer people, they have less money to spend on healthcare services, or in overseas they have no insurance to cover their illness, okay. So their final resort only when they have to be admitted in emergency. So that is the only medical care that they receive, okay, when they are need to be admitted in emergency room. So there are the biggest gap between rich and the poor in the use of preventive healthcare services. So like of course the rich people, they are more they are the one that will get the fastest access, okay, the broad of healthcare services, okay, like vaccination against diseases, okay. And also they will get the first screening for the treatable disorder, where they have the money to pay for that kind of services. Now we'll discuss on the final subtopic, misusing the healthcare services. So in the first two subtopic, we discuss on what factors that actually can lead patients on seeking out for the healthcare services. But in the third subtopic, we will discuss on how actually the healthcare services may also be abused, okay, and what factor that cause people abuse in using the healthcare services, okay, and how actually sometimes people seek out for the healthcare services for the problems that are actually not medically significant, and this attitude causing overloading of the medical system is actually increase the workload of the medical doctors, okay. So let's discuss. So first one, referring to the emotional disturbance. Research suggests that the doctor, research on most of doctors estimate that as much as half of two-thirds of their time is taken up by patients that complains on psychological rather than medical, okay. And this problem is more common for general practitioners than for specialists, meaning for those MOs in the outpatient clinic than specialists, okay. So and it is actually is a big issue, okay. It's a big issue because like as the general practitioners, as MO, normal MO, usually they don't know, okay, they don't know that what actually patients comes in for. So and patient didn't complain about their psychological symptom, patient just complain about their psychosomatic symptom. They have chest pain, they have back pain, and etc, okay. So this kind of patient that actually will visit frequently to the doctors, okay, and have also comorbid complaint about anxiety and depressive disorders, okay. So unfortunately, symptom like this usually lead the doctors to intervene with medical treatment first, which is not appropriate, okay, because doctor don't know, he don't know that this patient have a psychological complaint, so they will treat on based on the physical complaint first, which is inappropriate, so they give out the medication for painkillers, for example, okay, and then by after multiple visit, okay, and also slow recovery from the patient later, this gives some indication doctors that maybe this patient having psychological complaint rather than their own physical issues, okay. So this is one of the biggest problems, especially in terms of the medication, okay. So as we know that our government spend lots of money, okay, on the medical expenditure, especially for the medication, okay, and medication non-adherence, non-compliance, basically they're not taking the medication is one of the biggest issue, not only in Malaysia but also worldwide. It's like 50% of the patient then prescribed medication, they're not taking the medication given, okay. And can you imagine in Malaysia, like they only have to pay RM1 Malaysia for the medication, but they don't taking it, but the cost of medication itself is like billion ringgit, okay. So and it's not only effect on the medication but also one of the example, the consequences of a psychological symptom but not appropriately treated by doctors, it also can cause prolonged hospital stays. This is where patients may readmit frequently to the hospital, readmit frequently to the hospital, prolong to hospital stays, okay, keep complaining because they are not being treated for their specific illness, okay. They are being treated for their physical illness, okay. So why does this happen, okay? So research suggests that the stress, emotional, anxiety, worrying, depression, and psychological symptom, okay, this is like some a label to the patients, okay, some label to the patients. So they assume it is not it's not legitimate, okay. So the medical disorder itself is perceived more legitimate than psychological disorders, okay, rather than complaining about their emotional anxiety and depression, okay. So for example, anxiety itself, it can produce diarrhea, upset stomach, sweaty hands, short of breath, okay, difficulty in sleeping, poor concentration, and general agitation. Whereas depression can lead to fatigue, difficulty performing everyday activities, okay, loss of appetite, and sleep disturbance. So the patients also may define these psychological symptom as a physical health problem, okay. So this incorrect diagnosis of the illness, okay, may affect on treatment that's suitable for the patients, all right. And beside than this, another reason that has been suggested by research, people use healthcare services for psychological complaint. It's like because they don't want to get the consequences of being stigmatized by the community or perhaps their own partner, okay. Though so they still have the belief that it's shameful to see a mental health specialist or to have mental health problem, okay. Another reason is that the medical complaints or illness brings benefit, such as secondary gain, okay. So they can get ability to rest, free from unpleasant tasks, they don't have to go to work, okay, they can take time off from work. So this reinforcement interfere with the process of returning to good health. And actually the process of given MC, given rest, okay, taking time off is actually one of the factors that reinforce them to repeat the behavior again and again, okay. So finally, the inappropriate use of healthcare services can represent a true malingering behavior. Okay, a person who does not want to go work may know all too well all the only accepted excuse that will prevent them from being absentees from being formal absentees from the work. Okay, so they just require documentation for the absence. Also, they will shopping around different clinic to get for the medical sheets. Okay, and they will keep looking on the doctors who willing to treat for their malingering disorders. Okay, so again, these are one of the main issue how actually people with how actually to differentiate, okay, to differentiate between a patients or patient who really have that really need for the medical services. I mean, patient who really need MC, patient who really need to take time off because they are ill. Okay, but because of the behavior, those who are actually cheating or malingering, that cause some people with legitimate medical problems, okay, can be falsely assumed to be psychologically disturbed. Okay, and research suggests that doctors actually likely to reach this conclusion about the female patient having making story of their illness as compared to the male patients. Okay, so and even though objective measures suggest that it is actually equivalent rates of psychological disturbance, so meaning that as compared to male and female, doctors are actually usually falsely assume that the complaint given by the patients is actually a psychological complaint as compared to men. But in actual, it is true they have a physical complaint. Okay, so it is part false negative the impact from the malingering behavior from the patients or person who actually cheating on their illness. All right, so this is example of the second one. Actually, we will discuss on the delay behavior. The first explanation looking on the emotional disturbance, and now we'll discuss on the delay behavior. So delay behavior is putting off seeking treatment for one or more potentially serious symptom, for example heart attack. Okay, so here I share with you example of my interview with heart disease patient under my research. Okay, so MMS, 50 years old male Malay. So this is his quotations, okay, from the interview. That's why there are cases where people pass away suddenly or when they are asleep, like my younger sibling. He was at a meeting with his friend, suddenly he collapsed. I think my case is similar like him. At that time, his younger sibling wasn't aware about his blockage. Okay, so this is the previous quotation and this is the continuation of it. So we are Malays. So sometimes whenever there is blockage or chest pain, we'll just assume it's a wind factor, angin. Okay, and that's the norm if you are Malay. We will believe what our elderly believe. When there's chest pain, it's just a wind, so you will rub on your chest, on the oil, the hot oil, minyak panas, okay, on your chest, and you feel relief for a while, of course, because it's wind, right? But after that it'll come back. So like my younger sibling, maybe he had a chest pain but he just kept quiet about it. All of a sudden, when he got his blockage, he collapsed immediately because the blood isn't flowing anymore. Okay, so from this quotation, meaning that the patient have experienced several pain, okay, but he just ignore the pain and make his own treatment by rubbing the hot oil, and finally it become worsen and worsen, and finally he collapsed and died. Okay, so this is the impact of delay behavior in seeking appropriate medical treatment. So to understand this delay behavior, there are several stages to explain on the behavior. Okay, as you can see, it's divided into appraisal delay, illness delay, behavioral delay, and finally the medical delay. Okay, so appraisal delay is defined as which is the time takes and the individual to decide that symptom is serious. Second, illness delay is referring to time which the recognition that symptom implies an illness and the decision to seek treatment. Third, behavior delay, which is the time between deciding to seek treatment and actually doing so. And finally, medical delay, referring to scheduling and treatment. So medical delay usually for those who already have appointment, okay? But the times that elapse between the patient will call for the appointment, his or her receiving appropriate medical care. So they will they will ask for delay in seeking treatment for some symptom that is appropriate. Okay, for example, like I had my own appointment in hospital, so I feel like waiting for 6 month appointment. I feel I feel like my symptoms are getting better. Okay, I feel like I don't have to take medication anymore. So this is where I will cancel out. I will cancel by myself my own appointment without telling the doctors. Okay, and for your information, if like you have appointment in hospital government, you are only eligible within 3 months. If you pass the 3 months duration from your first appointment, and after that without calling you, they won't calling you, they just discontinue and terminate your case. Okay, so finally, what causes of delay? What causes of delay? So this is actually common. Okay, this is actually common for people to delay and seeking the treatment. Okay, especially if money is not available. Okay, so they may tell themselves the symptom not serious, so no need to seek for treatment. Okay, and also delay is more common of people with no regular contact with the doctors, and also people who are actually scared with the medical services. Okay, for example, like elderly patients. Okay, like my own grandmom. Okay, um I think most of other ladies scared being sent to hospital. So every time when we say we want to take them to the hospital, they will say, I don't want to die in hospital, I'd rather to die at home. So they have this kind of belief when you bring them to hospital, meaning they're going to die soon. Okay, so this related with how they perceive about hospital and also the medical treatment. Okay, and also this is also one of the example why they prefer to use the natural remedies and traditional medicine as compared to modern medicine. All right, so the symptom that delay seeking also it can be predict. Okay, so it can be a minor symptom. Okay, so it can be a symptom that not hurt or not change quickly, symptom that can be easily accommodated. Maybe you just use paracetamol, just use any cream at home, perhaps just put some minyak urat, okay, some ointment, okay, traditional ointment. So the symptom that not provoke any alarm harmful, so all of the symptoms can cause a delay in seeking treatment. Okay, so another typical symptom is like that easily being treated. This also cause of delay. So another behavior like also delay in taking recommendation treatment. They feel no more urgency about their condition. They meet the doctors during the first session. Doctor just say, this is just a minor. So I have experience, especially psychological symptom. Okay, I have experienced my patients that they went to clinic and then tell doctors, doctor, I have this kind of stress. I may need medication because I can't sleep. I'm hearing voices. So what happened? The doctor in clinic said, oh, no worries, you just stress out because of your study, just take rest, and also that will be cured. Okay, so what happened actually, that patient, this is true story, that patient is having more serious condition and worsen, and finally when they were advised to seek out for psychological treatment and to meet doctor for medication, so they avoid, because they said, I met with the doctor before, but doctor said my condition is not serious, it's nothing. Okay, so this is where cause them they feel no more urgency about the condition. Okay, and they refuse want to meet doctors. Okay, and Another behavior, another reason delay in taking accommodation also can be denial phase of the patient itself when they are diagnosed having the symptom, for example, like cancer. Okay, I think I mentioned earlier about cancer issues. Like I read a lot of article that the patients with cancer, they usually they do not show any symptom during the first or second stage, or even third stage. Also, you can't see the symptom clearly. Okay, so. So they become denial at the first stage. This is where they shop around, they look around for other alternative medicines, and they avoid of the treatment given by doctor, especially chemotherapy, because we know chemotherapy give a side effect to the patients. Okay, but uh, the situation become worse. Okay, they become worse and worse, and finally at the fourth stage only they will seek out for the proper medication, but it's too late. Okay, and another behavior and delay seeking treatment, it also can be happen because of the healthcare professional itself. Okay, it's not from the patient perspective, but it can be from the healthcare practitioners. Okay, so in most cases, research suggests that in most cases, healthcare providers delay as a result of their mistake. Okay, for example, like blackout might indicate disorders, apa tu, false diagnosis of disorders. Okay, and maybe the healthcare provider may choose wrong diagnosis, or maybe they rule out more common causes for symptom before proceeding to more invasive treatment. Okay, so like sometimes the process, not all patients, okay, not all patients can bear with the process, because like doctors, they have to go through to the minor treatment before they go towards for invasive treatment. Okay, so for example, like for the psychiatric illness, okay, what happens sometimes doctor will give the lower dose of medication, okay, to look on the patient's adaptive toward the side effect or the medication, rather than giving out the high dose of the psychiatric medications. Okay, but for some patient, they found out it's just the same. There are no difference. Okay, so this is where they say like, I take the medication given by doctor, but it's just the same. Okay, but actually as patient, we have to communicate with doctors. We have to respond to them. What are the feel? What are the changes that they experience after taking the medication? And from there, doctor will adjust the dosage more. Okay, so there are a lot of explanation that still they're still not certain yet to explain on what caused a delay behavior among the patients. Okay, and especially involving in seeking out for to get the healthcare services. So it is common actually for patients to ignore symptoms that are serious, and they delay in behavior in seeking treatment, but they don't know that it's dangerous for them to doing so. Okay, and I think this is also related with the current issues of COVID-19 itself, where sometimes they have the symptom of COVID, but they denial. They say like, oh, this is just common cough, because like as we know, the symptom of COVID, they are like a common flu. Okay, so being delayed of seeking treatment for a week, for example, and at the same time they already meet with different person, they already transfer the infection to different person, their family members especially. So this also create the dangers of delay in seeking treatment, especially for infectious diseases. Okay, so this is our part as health psychologists, where to understand the behavior and also to educate them the importance of not delaying and seeking treatment. All right, so I think for today, thank you so much. Okay, bye.